The next section in our series of topics will be postoperative instructions after joint replacement surgery. First, we will discuss weight-bearing precautions and range of motion restrictions after joint replacement surgery. The vast majority of joint replacements will allow you to be weight-bearing as tolerated after surgery. There are certain circumstances, especially in the revision setting, that will limit your weight bearing for a period of time, and each of these will be discussed with you on a case-by-case basis. With hip replacement specifically, there are some range of motion restrictions that may preclude certain movements after surgery, and these will also be discussed with you on a case-by-case basis. All of this will be in your discharge paperwork, and the physical therapist will go over this with you before your discharge. Our next topic will be postoperative dressings. First, we will begin with knee replacement. With knee replacement surgery, you will either have a skin glue mesh dressing over your incision with the brand name Prineo, or a incisional wound vac with the brand name Pico. The Prineo dressing is a skin glue mesh that can stay in place for 3 weeks after surgery. It allows us to monitor the incision, but keeps it sealed the whole time. Over this dressing, there will often be an A-strap and some padding underneath that A-strap. The A-strap and overlying padding will remain in place for about 4 days, and at that time you can remove it and you can shower at that point. It is important to leave the skin glue mesh on until your post-op follow-up visit with me, and then, like I said, it will be removed at 3 weeks post-operatively. If you have a Pico incisional wound vac dressing, you also can remove the overlying A-strap at 4 days and shower. It is waterproof so you can get it wet, and it will be removed at the 2-week postoperative visit. Specifically with that Pico dressing, the batteries may run out before your clinic visit with me. At that time, you can just leave it alone and it will act as an occlusive dressing until we take it off in clinic. The total hip dressings will be very similar to the total knee dressings. It will either be a Prineo skin glue mesh or a Pico incisional wound vac. If it is a Pico incisional wound vac, there will likely be no dressing over the top of it. If it's a Prineo skin glue mesh, it may have some gauze and tape over the top of it. If there's gauze and tape over it, then you may remove that at 4 days and proceed to shower at that point. With any of these dressings, it is important to remember that you should not submerge any of these incisions in water, clean or otherwise, until at the very least 4 weeks postoperatively when you've been cleared in clinic. If you have any issues with your dressing, whether they are coming off early or there's significant drainage through or around your dressing, or if you are having a skin reaction in the area around your dressing, please call the office immediately and we will let you know how to proceed. Our next topic will be postoperative pain control. Whether it is hip or knee replacement that you've had, the pain control will start with a non-opioid anti-inflammatory medication such as Tylenol. This will be a high-strength Tylenol and it will be your baseline pain control. In addition to that, you may or may not receive an anti-inflammatory such as meloxicam or Celebrex if you are able. The next line in the escalation of pain control is Tramadol. This is for when the pain is not too bad, but it is creeping upwards. Next in line will be an opioid such as oxycodone, Percocet, or Norco. If you take a Percocet or a Norco, just remember these have Tylenol in it, so you want to avoid taking Tylenol by itself when taking those medications. In addition to this escalation of pain control, you may also receive other pain modalities such as a nerve medication like Lyrica or gabapentin, or a muscle spasm medication such as Robaxin. It is important to remember that your pain from the surgery should decrease over time and your reliance on the strong opioid pain medications should decrease over time. It is important to taper off of these medications as quickly as possible, as some of them have addictive potential. We will prescribe pain medications for 4 to 6 weeks postoperatively, but the vast majority of people only require a couple weeks worth of the strong pain medications. Any pain medication requirement after 6 weeks will likely need to be handled by a primary care provider or a pain management clinic. Next, we will discuss reasons to call the office immediately or return to the clinic or the emergency department in the postoperative period. The first thing will be temperature above 101 degrees Fahrenheit or 38.5 degrees Celsius. Next, increasing persistent swelling of the legs or the feet. Increasing pain that is not well controlled by the current pain medication. If your incision becomes red or warm, if there's an opening in your incision, if there's new or increased drainage from your incision, if this drainage from the incision has a foul odor, if you are now unable to walk or put weight on your leg where you currently had been weight bearing, if you have an increased amount of numbness or tingling in the leg, if either calf becomes painful, swollen, and tender and does not improve with elevation of the leg, if you have skin breakdown in the area around a cast or a brace, or if you are overly worried, anxious, or very concerned about any issue that is currently affecting your postoperative course. This list is not all inclusive. There are other things that may arise, so if there's anything that is of utmost concern to you, please feel free to call. Follow-up appointments will be within your discharge paperwork, but typically will be approximately 2 weeks, 6 weeks, and 12 weeks postoperatively, and then will usually be spaced out in longer intervals after that. A very important topic in recovery from joint replacement is physical therapy. While in the hospital, whether it is a same-day surgery or an overnight stay, you will meet with a physical therapist to discuss weight bearing and any range of motion precautions after surgery. They will help you navigate getting around with assistive devices and will also take you up and down stairs. The vast majority of people are able to discharge home from surgery. At this point, from hip replacements, you will have the option for home health physical therapy, where physical therapists and occupational therapists will come out to the house to assist you in your activities of daily living and your recovery at home, or outpatient physical therapy, where you will travel to a physical therapy office a few times a week, which can sometimes lead to an expedited recovery. In some patients, a longer stay is required, especially if there's not an adequate amount of help at home. In this circumstance, the physical therapist in the hospital will make recommendations for either inpatient rehab or a skilled nursing facility. The case managers in the hospital will then send out referrals, and if accepted, the option will be for inpatient rehab or a skilled nursing facility based on the circumstance. Once discharged from one of these facilities, you would then resume home health physical therapy or outpatient physical therapy a few times a week. With knee replacement surgery, physical therapy is paramount. In the first month after surgery, knees become swollen, painful, and stiff, and it is very important to get your knee moving even if there is surgical pain still in the knee. The quicker that we can get to outpatient physical therapy, the better recovery and the quicker recovery that you will have. Logistics sometimes could be in the way, and home health therapy may be an option for the first 2 weeks after surgery. But like I mentioned, the faster we get you to an outpatient physical therapy, the better and the quicker the recovery will be. Whether it is home health physical therapy or outpatient physical therapy, it is important that you do your physical therapy exercises every day and not just when the therapists are around. This will make sure that the knee and the hip is moving correctly and that you are recovering at the fastest rate possible. This will also prevent other issues such as blood clots and pneumonia, which can come from immobility after surgery. Occasionally, we will use adjuncts to our normal physical therapy protocol that could expedite your recovery. There sometimes is an option for an exercise bike that is specifically designed for knee rehabilitation, as well as an ice machine that can help provide a constant flow of cool circulation to decrease swelling in the knee. If you're interested in either of these, we can discuss this at your office visit. It is commonly questioned if we use continuous passive motion or CPM machines. The literature has not borne out any utility in using these machines, and most joint replacement surgeons have gone away from this technology. Swelling after hip and knee replacement surgery can be normal and can persist for many months postoperatively. This type of swelling typically will resolve with elevation of the lower leg and upon waking in the morning. If the swelling does not improve with elevation or with rest at night, and the calf becomes painful and tender, you should be evaluated immediately to make sure that this is not a blood clot. Another common question after joint replacement is, when can I return to driving? Many studies have looked at this, and the vast majority have concluded that by 12 weeks postoperatively, most patients are driving again. This does vary somewhat by which side your surgery was on. With left-sided surgery, return to driving is typically a little quicker than right-sided surgery. The main determinant of when you can start driving again is the reaction time to get your foot from the gas to the brake. The vast majority of patients, whether it's a hip or a knee replacement, can return to driving by about 4 to 6 weeks. With it being the left side, this could be closer to about 2 to 4 weeks, depending on the situation. It is always important to consult with your doctor prior to returning to driving, and when you do return to driving, it is important to try this in an area that is not very populated, where you can safely test to make sure that you are ready. Each of these situations is unique, and use good judgment to make sure that you are safe to return to driving. Patients and dentists alike have questions about taking medications prior to dental treatment after joint replacement. Each patient and situation is unique, and each surgeon does have their own preferences for this. In my practice, I typically will recommend waiting at least 6 months after joint replacement surgery for a dental cleaning or invasive dental work, unless it is an emergency. And for the first 2 years after joint replacement surgery, I do recommend some sort of dental prophylaxis prior to that cleaning or invasive dental procedure. We typically will call this in, but some dentist offices will prefer to call that in themselves. Many patients inquire about prehab or preoperative physical therapy prior to joint replacement surgery. Each individual circumstance is unique, but at the very least, doing some exercises in preparation for surgery can help make sure that your range of motion is as good as possible beforehand, and that your muscle tone and muscle strength is as good as it can be before surgery. There are some people that do wish to go to physical therapy prior to their joint replacement surgery. It doesn't necessarily mean that your recovery will be any better or any faster, but it certainly can make you familiar with your physical therapist and with some of the exercises that they would have you do postoperatively. At the very least, it is important to try to do some of the exercises provided to you in your instruction manual prior to surgery, so that you are ready to do them postoperatively and can help expedite your recovery.